Hello everyone, this is Dr. Vinesh again. Let us now discuss a very interesting topic, that is monoclonal gammopathy of undetermined significance, or MGUS. Okay, so coming to the introduction, it is a condition which is characterized by presence of abnormal monoclonal protein, that is M protein in the blood, which is produced by plasma cells, as we all know. But how is it different from multiple myelomas or lymphomas, etc.? We'll see that. So although the patient is asymptomatic of MGUS, it can progress to serious conditions like multiple myeloma. That's why it is important for the early diagnosis of MGUS. Coming to the epidemiology, prevalence is 3 to 4%. Okay, over 50 years old. So old age people are more predominantly affected by MGUS, and males are more affected than the females. So risk factors: age, family history, and African American ethnicity people. Coming to the pathophysiology, our plasma cells produce M protein. Okay, but it does not cause organ damage like it happens in multiple myeloma that we know as a crab, right? That's hypercalcemia, renal damage, anemia, bone lytic lesions, etc. Right? That is not seen in MGUS. That is important. And there is no significant increase in plasma cell numbers. That comes in diagnostic criteria. We'll discuss in further slides. So clinical features, typically they're asymptomatic, but sometimes patient might have fatigue or peripheral neuropathy. And there is no evidence of organ damage. This is important. As I said, hypercalcemia is not there, no renal failure, anemia or bone lesions are not there. Coming to the diagnosis, so what we do is serum protein electrophoresis, immunofixation electrophoresis, and serum free light chain assays. For what we'll see now. Okay. So now coming to the criteria for the diagnosis of MGUS. M protein, serum M protein more than 3 gram per deciliter. Next is bone marrow plasma cells less than 10%. Okay. Usually in multiple myeloma we'll get plasma cells more than 60%, but here it is less than 10%, right? And no CRAB criteria should be positive, right? Like there should be no hypercalcemia, no renal dysfunction, no anemia, and no bone lesions should be there. This is the diagnostic criteria, 3 points. Next is there are different types of MGUS. We'll see non-IgG, this is IgG MGUS, and IgM or IgA light chain MGUS. This is important to see because each subtype carries a different risk for progression, guys. Okay, we'll see what are the risk factors, for the progression to the multiple myeloma or other cancers like lymphomas. Okay, so annual progression risk is 1% per year, right? And it can progress to, as I said, multiple myeloma or Waldenström microglobinemia and amyloidosis. Okay, what are the risk factors in which there is high chances of progression? One is high M protein level, guys. That is more than 1.5 gram per deciliter. Next is abnormal serum free light chain ratio, right? If you see free light chains like kappa, lambda, and we do the ratio more than 1.6 or 2.4 like that, if the values are abnormal, then it's high risk for progression. Next is IgM or light chain MGUS. As I said, non-IgG MGUS like maybe IgA, IgM or light chain, it has more risk factors, risk for progression. Okay. Now coming to the management, there is no specific treatment, only observation is the key here. So monitoring has to be done regularly, like 6 months, patient has to be called and do regular PEP and free light chain assays. Okay, and clinical evaluation for the symptoms of progression. Next is lifestyle recommendations like healthy diet and exercises and avoidance of factors which can cause the stress to the kidneys, like using NSAIDs, okay, because they are nephrotoxic. Coming to the prognosis, most individuals remain stable without progression. A regular follow-ups is crucial to detect the early signs of malignancy, right? So coming to the conclusion of the topic, MGUS is a benign condition but requires monitoring. Understanding the risk factors helps in stratifying the patient for surveillance. As you know, as I said, there are 3 points: M protein more than 1.5, and non-IgG MGUS, they are more prone for the progression, right? And early detection of progression ensures timely intervention. Thank you.